Okay, and let's get the slides going here. Okay, and let me share our screen first. Let's see. Share screen. Just got used to Blackboard Collaborate Ultra, so Zoom gives me anxiety. I've done calls on it, but I have no idea how to do all the other stuff yet. Yeah, I'm still getting the hang of it too. It does a ton, and it's really intuitive and easy. It's just that I think of crashing systems. Folks online, can you see our screen? Can you see the slides?
Yes.
Great.
Yes.
Okay, let's put it in slideshow mode. And I'm going to hand it over to the presenters. And because we have so many presenters, you're going to hear them asking me to move to the next slide as we go. Great. All right, so hi everyone and welcome. It is my job to provide you with an overview of kind of where the study came from and how we began, which was a long, long time ago, I think. So 2 years ago, the National Council on Disability had sent out a call for participation in a follow-up study. So Krista, you'll go over that, but that this is a study that had been done before to assess foreign policy and disability inclusion. And they're looking for a new team to kind of come at this with a new approach and assess next steps and where future directions. And so at SCISD, we have our course, Transdisciplinary Research to Practice. And we really thought that looking at U.S. foreign policy and disability inclusion with our unique lens would be an asset. And so Ashley actually was driving force behind this and helped me develop the proposal. And they said yes, which we were very excited about. And we happened to have a team of students who last year were enrolled in our course 898 and looking for an experience to apply their skill set. And so we have myself, Ashley, Krista, Jim, Uche, all on this very large team kind of trying to grapple with this big question of how is disability included in U.S. foreign policy within foreign agencies. And so we spent a long time working kind of on how to conceptualize that, our research tools, our methods, and I think I'll pass it off to Krista to introduce the methodology next. Oh, actually, is it Uche? Sorry.
No, sorry. Okay, so the National Council on Disability is a federal agency that advises the President and Congress on policies, programs, and practices regarding persons living with disability. It consists of both presidential nominees and congressional nominees and also staff. Basically, so the research centered around looking into how inclusive selected U.S. International agencies were inclusive of persons living with disability in their programs implemented abroad. So the agencies selected were USAID, the MCC, the State Department, and the Peace Corps. So basically, we're tasked with also looking into recommendations regarding these agencies in previous NCD reports to follow up with that to see if there have been any changes in the past year as well. And also, those recommendations had to do with access to buildings, access to information, even for US citizens living with disabilities that travel abroad, how to have access to information, and also accessibility for US embassies abroad for persons living with disability, and also persons living with disability that work in these embassies abroad, how accessible they had, possible access to information. So we had to follow up with that from previous NCD reports. So these are the figures that we have right now regarding US foreign aid. We can see that there's a huge difference between the budget for 2017 and the budget for 2018. At the moment, well, by the time, as I want to prepare this slide, the budget for 2018 was 25 billion. But now, just looking at it on the website, we've seen that it has increased to 28 billion. And this has to do with inconsistency with the present administration really and back and forth. So you can see how that affects what's going on with regards to the budget and yeah. So with regards, literature and research, show that there's been global improvements in global health, education, and poverty reduction for in the international development arena. However, it's not news anymore that the poorest of the poor still fall through the cracks and are not able to really take advantage of the development that is going on everywhere around the globe. And we can see the huge figures there for disability in developing countries. And it really keeps increasing, and it various reasons that cause that huge numbers that we're seeing there. It could be childbirth defects, it could be accidents, conflicts, name it. And so it's obvious that this population really needs to be accounted for as we go on in the international development arena. This population also experiences social exclusion, economic exclusion, and physical exclusion, as we all know. And also, based on our findings in our research, we've seen that they are not really accounted for in international development programs abroad, because international development organizations are still grappling with how to actually go about and operationalize this on the floor. Some of them have good policies in place, good directives about how they want to go about it, but they haven't been able to. It's been a struggle on the ground, really, and just finding ways to go about it. So that's one of some of the things that popped up as we did the research.
And just quickly before Krista goes, one of the true intention of this report is that the U.S. is kind of the major driver in development. And so that if the U.S. is driving development, and the U.S. is very progressive in disability rights here domestically, the U.S. should be that driver internationally. That should be our moral authority, right? That we're being inclusive across our programs, our 20 plus agencies, our 100 plus countries. We're very influential all around the world. And so how do we do so? How do we encourage those agencies to pick up this moral obligation? How do we do that legally? And then how do we do that from an organizational perspective?
All right, yeah, so the purpose of the NCD report, obviously, and Valerie started on this, but was a follow-up to 3 other reports in 1996, 2003, and 2013. And we were looking at the application of federal disability laws to foreign aid programs. And Uche touched on the 4 organizations that we each looked at. Each of us looked at in depth to one of the 4. And what we were looking for was the application of the disability policies of each organization, how they were inclusive of their employment opportunities and volunteer opportunities, how accessible their physical access was and their web accessibility for people with disabilities, and also how inclusive their disability and were in foreign assistant programs. But another thing we were also looking for was the agency-specific examples of promising practices and projects, and also missed opportunities where they could have improved on different opportunities for people with disabilities. We used a variety of methods to conduct the study. We all started with in-depth desk reviews, so we were looking at different applicable legal and policy documents. And we conducted key informant interviews. So we contacted different employees, volunteer, program participants from each agency. We called people, we emailed them, and we also were able to sometimes be able to meet with people face-to-face. Sometimes contacting and getting back was very difficult. So that posed a challenge to be able to get some of the information. We used a collaborative writing and reporting with all team members. So we kind of shared information back and forth, and we used an iterative feedback, which kind of, I'm sorry. Which was kind of repeating. We'd share with the agencies and then add it back into the report. So the report was constantly changing, which also kind of posed a challenge. It was difficult to keep up with current findings, which I think we kind of touched base upon, but especially with the new administration, things were always changing, and we were not really sure where it's going to go with the report. And we also used surveys to assess the accessibility of agency programs and facilities, including informational, attitudinal, and physical access. And I think that's it.
Great. I can't overstress the nature of the study during the change in administration. One, just any change, right, good or bad, and two, the direction that the agencies all took. That impacted, I think, our access to data significantly, and that was one of our key findings, is that there's not a lot of information around disability due to lack of data disaggregation, so we don't track it anyway at agencies, but two, because we don't want to share it with you, and we find your questions to be, frankly, threatening and not useful to us because you're not going to find much progress. And so when you look at a study like this and you're going, we titled it Progress and Promises, and in fact, we're seeing a retrenchment. That's a really hard report to write. Because even since this is going to press our report, March 8th is when it's released, the data was collected by the end of June, and we've been in draft review since then. And so between June and March, it's a very big change even then. In addition, NCD, what's important, is considered an agency at par with these agencies, and they still wouldn't share information with us. We actually had to do a FOIA with the Peace Corps and formally ask for data and information, and they still didn't share it with us. The iterative feedback you talked about is that when the report was written, the sections were all sent to each agency with the recommendations and findings, and some of the agencies came back and were like, wait, no, we do that. And why didn't you ask us? And luckily, we worked with the National Council, which is so understanding, and said we did. In fact, here's our paper trail of us asking you multiple times, and you refused to answer. So here are our findings, because we don't believe you're actually doing that. And so it's an interesting place to be, because we were taking an organizational theory approach to this, and we were working on progress and promise, and we call that positive deviance. We're trying to make actionable recommendations that people like. Yet we can see, due to a variety of factors, we're not getting answers. That being said, key findings. A lot of these are natural, I think, with any organization. So we still have an extreme silo effect to disability work. Organizations either have a key person that deals with disability or no person that deals with disability. It's a passion of a few. It is not an institutionalized policy. We didn't have policies across the board. In fact, the policies we found were outdated. We'll go in the next slide on very specific examples from each of the agencies. In terms of employment, where we looked at that, there's a significant underrepresentation of people with disabilities. This is the same in previous reports, except this time we found that the hiring of people with disabilities at some agencies was relatively good, but the retention of employees was really poor. So our numbers are the same, but for different reasons. And we can look at kind of administrative barriers and supports in our workplace for answers to some of those problems. Again, there's an absence of accountability. We took this organizational theory approach where, how do we look at ensuring that disability is included in all facets of the organization? And since there's no clear policy and institutionalization and support for that, we're seeing that silo effect, but we're also seeing that there's not disaggregation with the data, just naturally within all the systems, and that monitoring and evaluation is really poor. So if we look at, I think it was USAID had a white paper written on it, there's now a clause that you include people with disability in program design. Yet, no one at USAID reviews that criteria when reviewing program proposals. Thus, people with disabilities are not included. And that's an accountability problem. That is about the institution not tracking its policy effectively and ensuring that that principle is valued but also tracked, and those proposals should have been balanced. Like if you don't include gender, right? That I think any proposal now, if we don't include gender, it gets pushed right back to you. So it's about that core importance. And then lastly, our key findings, we had a lot of resource deficiencies, which we've seen. So we've seen funding levels obviously decrease with this administration, but we've also seen massive cuts in terms of staffing. So Judy Human at State, that position, since we wrote this report, has been eliminated, and those staff have been moved into different programs. And so we're seeing kind of that back. The human resource isn't there, as well as the financing and disability-specific programs aren't there. While we wrote the report with a positive frame and what they could be doing differently, again, it was really difficult with the significant changes we've seen over the last year. So I thought quickly we could do examples. I've given a couple. I can start with Millennium Challenge, one of the most interesting things that I found out about the Millennium Challenge Corporation is that they enter in, they're a different agency, they enter in compact agreements with international or countries around the world. And they have this wonderful social inclusion policy. And it's phenomenal, right? Then when you read it, it talks about including all vulnerable groups, but then when you get down to like all of the accountability metrics, they only talk about gender. So there's this like major gap between this beautiful policy and what they're actually doing. And for gender, they do a phenomenal job. They have technical support on both sides of the fence. They have funding lines. They have trainings and capacity building around gender inclusive development opportunities. They have evaluation metrics. It's all there, except they lost all the other vulnerable groups when they got that far. And so for me, the Millennium Challenge was a clear example of a huge opportunity. If you can reframe your social policy and ensure that all different groups are included, then it wouldn't be that difficult to make that jump. Instead, they could give me like 4 examples of really great projects they did. But they, again, were based on people's interests. You know, oh, we know someone and they needed accessible airports in Egypt. So that project was really stunning and done well, yet it was only in Egypt and not in other fun projects. Ashley, do you want to go with the USAID example?
Sure. USAID has quite a few examples in each of the things that we're talking about. And I think the challenge with USAID is that they do have, if you look at their websites, if you look at the reports that they put out, they're clearly doing great work as a whole. They are big on focus on transparency and reporting and things like that, except for when it comes to disability. One key thing that I thought was interesting is that in communicating with them, I was asking about a budget for disability, and they kind of proudly told me that for the past 10 years consistently, they've devoted $25,000 to disability inclusive projects. And I checked like 3 times to make sure that that's what they meant. Their annual budget is $15 billion. So that's 0.002% or something like that. But in their mind, we're consistent and we're doing this. And you can also see similar things like that too. They have a ton of resources in terms of ability to search and track their investments. So Development Clearinghouse, they have a ton of reporting, and unfortunately, there's no disability search term in any of their things. So, but they do have one for animal husbandry. So if you're very concerned about what projects are doing animal husbandry, you can do that. But there's not a way to search specific for disability. The search in the other challenge is that even if you were to do a keyword search, it comes up with any mention of like an EEOC, equal opportunity thing that goes into almost everything you publish. And so it will falsely tell you that there's something. So that's a challenge. And then, I think what Valerie brought up around the human and fiscal investment, USAID is one of those places that unfortunately they haven't had a disability coordinator since 2014. They then moved that position, so the way they frame it is that it's intended to make disability more a part of their mainstream development. So they moved it to vulnerable programs. Well, unfortunately, that person has since left as well. They had a disability fellow who is now an education fellow, not a disability fellow. So when it comes down to it, there's not one person doing that work. And so when you think about the fact that, as a whole, we're committed to reducing extreme poverty, and we have 800 million people with disabilities who are living in developing countries, but we don't have one person even who's looking out for them as a whole. And the U.S. is the largest contributor by volume to official development assistance. So when we look at kind of messaging and vision and values, it's really difficult to see how they're making this effort, because the proof is kind of in the pudding, I guess, and their pudding is old.
Well, they also provided a good example of an outdated disability policy, a lack of accountability, lack of human and fiscal resources. They're kind of all in one, a lot of the examples of the key findings. State was also a good example. I think of progress, actually, with some of the human rights reports.
Yeah, there's some. I think state is probably the poster child for the shifting landscape in all of this. Although, to the extent that we were working before the election, I think we found a lot of things that probably are still problematic at the State Department. So I just kind of went in order of the silo effect and so on. And I think probably what sticks out, right from the get-go is that in terms of a silo effect, you start with really a lack of of sustained coordinated engagement. It goes right to the basics. If you go to the State Department website or talk to people, they have no overarching policy on disability rights. It's just no statement. Doesn't mean different departments and bureaus don't have their own statement, nor does it mean that those statements aren't somehow related to one another. It's just that there's nothing that kind of forms the umbrella for all of it. And it's kind of a formula for consistency. And by way of example, and I think that inconsistency is, you see it with sort of how they treat employment issues, how they treat, building issues, how they treat, sort of what department does what, even how they treated the request for information. So for example, Educational and Cultural Affairs, if you go to their website, it's gorgeous. It's got all kinds of information. They've got examples of all kinds of programs, and they've got, it's kind of, it could be used as a model for the rest of the State Department, I think, in a lot of ways. But if you go to, almost any other part of the State Department, website, it's very difficult sometimes to find things. And I think that, that's a sort of an organizational silo that I don't think is directly the result of the election. I think that's just there.
Can you talk a little bit about the influence of Judy Heumann in her role?
Yeah, and another one, initially, that was actually my next point, when we were doing the research, there was a special advisor for international disability rights, Judy Heumann. And a lot of people that I spoke to in state referred to her as being the sort of the person who's going to draw all that together. And in a lot of ways, she was sort of a minister with a very sort of broad portfolio. And I think that informants at the State Department really talked about I think to her influence at keeping disability rights sort of in the picture and even in an informal way. Now, by the time this goes to press, not only has the election happened, Judy Heumann has left, but then the position itself was folded into democracy and human rights and labor, then just sort of left vacant. And now we find out within the last few days has been eliminated entirely. So there's a problem, I think, there. And I mentioned that siloing even with information. ECE, the Economic and Cultural Affairs, they not only talked to me, but they sent me stuff and followed up on it. When I went in to ask about sort of employment practices and things like that, I had to go through a 2-month process of them vetting it internally. And so, it really, there's a lot of siloing, and I think it impacts a lot of areas. In terms of the, ultimately it impacts, the accountability. There's no real accounting of, well, if you look at the report, you see, for instance, things like, complaints under the No Fear Act, and you can't really be sure how to read that, nor can you be sure how to read the employment history with respect to hires, and there are reasons for that. I think in terms of the ability, whether that's not hiring or the ability to retain people, and so that's not really accounted for. And what's probably not as obvious is that the State Department has several areas. They hire people in the country to work, in the U.S. to work at the State Department. Then they have foreign service people, and then on top of that, they hire local vendors and people to to do some of the day-to-day work. The first two, you kind of know what's happening in terms of hiring and firing and retention and promotion. As far as the local, there's nothing. It's really very difficult to know.
And just one more point, just trying to find them.
Okay. Yeah, the human rights reports. That's a that I think over time has been a really strong, sort of movement forward from human rights reports that included virtually nothing about disability to now having not only a section that's dedicated to it, but even mentioned elsewhere, there's some cross-referencing. Now, unfortunately, we don't know what will be in the next one. We've just learned in the last couple of days that this new report has been delayed so that it can be cut back substantially in terms of how it reports human rights across the board. So we're not really sure whether we're going to be outdated or post-dated rather, or anything else like that. Go ahead. I'll let it go.
Yeah, no, that's great. I think the human rights reports were a glowing example of progress and what Judy's impact really had been. She did a lot of educating, and you could see the disability was really included throughout these reports. I forget the exact statistics, but the increase in mention of disability was like up in the 80s. It was a phenomenal job.
Yeah.
So now we're a little nervous knowing that there's a new structure coming down. What was included there?
I will say Judy has a fantastic podcast/Facebook presence. It's called The Human Perspective, spelled like her last name. So if you are interested in the work she's doing now, it's like my favorite thing on Facebook. So,
all right, you want to give us an example or two from Peace Corps?
Yeah, real quick, like we had said, they were very, very, very difficult to get their they were not transparent at all. We had FOIA requests out, and they were not, any person you talk to, it just got trickled in to send the FOIA requests, and it was very difficult. But they had really good LGBTQ websites and 50+ websites. They did so much outreach and recruitment for those two populations that it just was a huge missed opportunity for people with disabilities. Their web pages were phenomenal, and it was just, they did so many projects within those two populations as well. I mean, part of their mission is like promoting diversity and inclusion, but they just seem to be sort of sidestepping this population. Same kind of issues with the other organizations. The search words on their websites bring up almost nothing. You have to dig really deep to find projects. There was one volunteer who was that I had some contact with, who she was kind of helpful, but she said from her experiences there was just a huge gap in like support services or somebody to talk to, just people, employees, just they really didn't have a dedicated position. They said that they did, but then that person always just sort of referred you back to somebody, and you just got bounced around. So
Peace Corps is interesting too in that they have a pretty standardized approach to reviewing the medical and physical history of applicants, and so that's where disability usually comes in. But unfortunately, there's no proof that they do that consistently. We also don't know who's responsible for doing those assessments, and so it's challenging for someone who has a disability who wants to volunteer in the Peace Corps, because you have to go through the entire process of applying and doing all this stuff, and then at the very, very end is when they do your kind of medical and health review stuff, and so you can have gone through this entire process and then have them say, sorry, and it makes sense that there are certain places that folks with disabilities would not be able to travel for cultural reasons, where prescriptions aren't allowed or medical treatment isn't available, but there are opportunities out there, and those are certainly missed as well. I think that's important to reiterate that there. I think your next one, Ash. Oh, great. So you heard about all the problems, right? And I think that we, as Valerie said before, we definitely went into this trying to be as positive as we could be. One, for the purpose of building relationships and trust within these agencies, but also because you do want to celebrate progress where it's been made. And as we started to go along, we realized that it was more and more difficult to find some of those things. And so when we're looking at developing recommendations for the agencies, we wanted them to be grand in scale, in the sense that they represent the huge number of challenges that we're seeing there, but we also want them to be practical. Because what happens is that you make these gigantic recommendations, and then we know the agencies don't have the fiscal or human support to do them. We know that, we've looked at some of the recommendations are the same from the 1996 report to 2018. And so clearly, we know what's going on. It's how do we do that? And so we tried to create a little bit more of an applicable, practical approach to the recommendation. So what we came up with is this idea of disability being at the core of, at the core of foreign aid, and the core of their values, the core of their approach. And so what that looks like is that it's collaborative, meaning that we're engaging multiple diverse perspectives in it, that we're including people with disabilities and asking them about these things, that our departments and projects and programs are working together, that it's operationalized, that we have policies that guide the way that we're going to do this work, and that they're followed, that they're tracked and measured, and data is reported, that they're resourced. Clearly, we saw that huge drop from 2017 to 2018 in terms of the budget. And what's, I think, scary is the word that I would use, is that we know even when they had more resources, we still weren't having great outcomes. And so as those resources diminish, it brings a new thing to light with how do we do more with less, less fiscal engagement, less human engagement. And then equitable, how do we make sure that when we're doing projects like LGBTQ inclusion or over 50 inclusion, or, how do we make sure that people with disabilities are part of that conversation? And part of that is a values thing. It's saying that these are folks that are important. The other part of it is looking at it from a big perspective, So we really came up with individualized recommendations that go within those. And if you look, we can share this. Hello. We have a handout that we had here, and we'll make sure to send that around too. And it kind of talks about the individual large-scale things that we talked about. So collaborative, the U.S. has not ratified the Convention on Persons with Disabilities. If we're the leader, we get the most money by volume, not percentage, cheap when it comes to percent. What does that tell everyone? That we need to model these things. So if we have a really limited workforce, or it's not inclusive of people with disabilities, why would we assume that they're going to do that in other parts of the world where it's more difficult? We also looked a lot at operationalizing and mainstreaming disability inclusion around programs. We saw a lot of this twin track, which is a little bit of disability and then disability within everything. But unfortunately, none of those programs talk to each other. So the resources they do have are stretched pretty thin. And then, in terms of legend, we didn't talk much about the legal component of the review that we did. We worked with a wonderful partner from the University of Washington, and she went through tons and tons of material and cases and case law, and there just wasn't anything to report almost. Things have been pretty consistent, and the likelihood that we're going to see any positive change currently is kind of far and few between. So we tried to really just stay focused on what we think that agencies can do. And when the report's released on March 8th, you'll also be able to see all of the agency recommendations. So we have a whole table that breaks them down into these 4 categories for each of the 4 agencies.
Do you want to go through them or move on to vision?
I think we can move on. Yeah. I am going to save some things so you have to read the report.
I think we've covered them.
Okay. Yeah, actually, you can go right to the next one. So, in terms of translating, vision to practice, we have, this idea of putting disability at the core. The question is, sort of how do you know you're doing that? And so, these principles were kind of what we came up with. First, that being left behind, it's kind of speaks to a commitment to inclusion that should kind of pervade everything else. Proactive approaches. The recommendations we made were kind of, they're meant to inform progress and not just quick fixes. Part of the problem is, a nip here and a tuck there that doesn't really, sort of get to the heart of it or the core. To go beyond, non-discrimination. I mean, for example, the difference between EEOC compliance and inclusion is kind of huge. And so, if you're really looking to move forward and to put this, at the heart of things, then you've got to go beyond there. And then finally, to lead by example. we do lead by example as a nation. And whether we realize it or not, and certainly U.S. Domestic and foreign policy is very imperfect in the area of disability, but it's a heck of a lot better than a lot of other places, and a lot of those places look to us to provide an example. So I didn't try to lay that out in terms of the whole core. If you go to the next slide, I think you can kind of visualize this as being we have our core, but how do you know that you're sort of proactively addressing that core? And I think if you apply those principles, you could probably lay in a state Peace Corps, and they can do it themselves to see how they're doing and kind of give themselves a report card. So I think that'll.
Wonderful.
Questions, comments?
Thank you all so much. We can start with the people in the room who might have questions, and then I want to bounce to the people online who might have questions. But Sue, I see you have a hand up.
This is really great, and I learned a lot, so thank you so much. It was really interesting.
You're welcome.
I've worked with all of these government agencies. I was a Peace Corps volunteer. I worked at USAID mission for 4 years. I worked at the State Department, and I've worked on assignments for MCC. So, so
Why weren't you on this project?
So do you think that we're right?
well, yeah, there's a couple of things specifically I just wanted to mention quickly, and then I'll give you a little different vision. So, Valerie, you're talking about the MCC and gender. I remember when MCC was created, I worked with a lot of people working on the MCC. The reason why gender was such a revolutionary approach was because there were so many people pushing for that, and there was probably very few people pushing for disability. So that's why they went there, which was phenomenal at the time when it happened, but it's frustrating in terms of other groups that aren't addressed. Just don't.
Yeah, exactly.
And regarding the website that you think is so wonderful, that happens to be under the purview of the communications department at the State Department. So they have all the resources regarding web materials and the budgets. And so anything under that's related to communications, or you're talking about programming for that department, that's also under communications, public relations. So that's why they pay so much attention. But other departments who are focused on other things don't care about that as much. So it's not their priority. And then just in terms overall, hearing what you're saying, it just reminds me so much of the gender fund, because I'm a gender person, a disabilities person. And we had the same thing, and it wasn't until, for me, Hillary Clinton is such a hero for me, because she was a top-down person that integrated mainstream gender issues into state and USAID. And when that happened, we've been pushing for so long, and they had such crappy departments up until that time. It really was a top-down thing that benefited both agencies really well, and continues to this day. And so I think about voting blocks, people with disabilities voting, more people with disabilities voting leads to a bigger interest group pushing for these things from that perspective. And then also top-down approaches, getting people who care about disabilities into key positions can help to create more change.
Yeah. No, actually, that's what I said when I institutionalization of these goals. I think you can't overstate that you need expertise and qualifications, people of interest, but you need this to be an umbrella. UNICEF was a really good example of that. They had a disability office, but it used to be under you do child protection, or you do education, or you do child health. And they were all in different departments, and it was just because someone thought disability might want to be included. It had no overarching structure. And then Rosangela Bierman was hired there to refit, and the director of UNICEF said this is an organizational priority, and it must go from the top down and trickle through all aspects. And it became a much more cohesive approach to disability, and accomplished so much more. But it's great to have the expertise and have the great little projects I think we found, but without that hierarchy or institutional push, it won't go.
I think and this might be just because I'm a little bit naive, and I don't know all about this. Is there any, and maybe not with this particular administration, but just overall looking at disability and intersections of different kind of vulnerabilities or identities within that, to kind of, as you mentioned, kind of other vulnerable groups, and kind of how disability kind of fits in, every vulnerable group.
Right.
Because,
There's a little bit. I would say that at least in terms of our report, there was a little bit of that, I think, in the human rights reporting and the growth of it. And specifically from the point at which there was a section for each country's report dedicated to disability. It went from there to appearing in the introductory section, and then you started seeing it in terms of women's rights and labor, and it started popping up in other places. So I'm not sure that they would have called it intersectionality, but they were kind of doing that.
I think one place that I specifically looked towards was strategic planning that all of these agencies are doing. And so, for Peace Corps, for instance, we went through their strategic plan. They had a strategic plan, and then I forget what the other big document was. It mentioned disability twice, maybe, in the official numbers in the report. The USAID strategic plan has zero mention. Their 5-year kind of human rights and whatever, zero mention. And so what that tells us is that I think, unfortunately, either it's until disability becomes an issue in its own right, it's hard to kind of point towards intersectionality.
Right.
Alternatively, I think we have seen some great work, not necessarily in this report, but just in general in disability inclusive development from, women's rights groups that are being inclusive of people with disabilities. Kind of this backwards, not how you necessarily picture it. The same can be said for, if you look at international development as a whole, so the SDGs are inclusive of people with disabilities for the first time. The MDGs had no mention, not even one, which is terrible. And now there are goals and specific targets but what we didn't see was how that is impacting U.S. policy and U.S., driving it that way. And so as much as we talk about wanting to be leaders in that area, there's also a time to step back and say, the rest of the world is doing this, and maybe we should, try and catch up there and look at the ways that we can maybe do some of that work. So we shall see.
The other part you talked about is other vulnerable groups. We did that with World Bank. We met with their data team, and they're like, okay, well, you're the third special interest group that's come to us this week. Like, how about you all get together and tell us how to be inclusive? Because I can't have one for you, one for you, one for you, and one for you. I have 23 groups, and you're all asking for something different. And so I think from that feedback, we didn't get into it with these reports, is that's why we focus on institutionalization of vulnerability. It's not just disability. It could be all vulnerable groups. And the SDGs do that, right? They kind of have a more inclusive perspective, but also that's where we need to work together. So, we're siloed by, organizational structures, but we're also siloed by a special interest. And this is definitely a special interest report, right? Disability only. But when we talk with these agencies, we have to find a way that synchronizes all of the work. That's why I point out a lot of the MCC work on gender, because it's so good. It's not that hard to envision if you looked at all the other groups and embedded an inclusive practice around that. It wouldn't be a stretch to design that. And I think that resonates a lot more with organizations and development agencies than just one specific group.
I just want to take a moment and ask if anybody who's joining us online has questions that they want to share. Okay, we can stick with the room.
I love how they're different names. Everybody's here.
Yeah.
That was staging.
That explains it.
I remember when I was applying for and developing this grant with Valerie, I talked to Dean Kiernan about the project and kind of said, hey, we're applying for this. And he said, well, good luck to you. It's a lot of work and it's not a big budget. And I was like, yeah, but we're going to get it. And he was like, okay, good luck. And we did, and he was right.
Yeah.
That's one thing I will say about this report in general is that it certainly takes like an actual village to do this. There's no way without the transdisciplinary students working with us on this that Valerie and I could have done this whole project ourselves. And that's because of I think it's because of the lack of institutionalization. So rather than having to go to one department and say, tell us about your disability work, you have to go to 27 departments. And then you have to fill out a FOIA request.
And it's like,
We
follow
can't.
up with that.
And
one.
follow up with that one every 3 weeks until you know,
On multiple domains.
yeah.
Physical access, informational, attitudinal, employment, programmatic, legal. It took us a solid 3 months to come up with our strategy for tackling this. And this is our, little test on how to present it even. And I think we could probably talk for about 4 more hours about other parts of the report that you're not giving snapshots of.
The report itself is 136 pages. I mean, it's a lot of content.
It could have been 250.
It could have been. We cut it in half, almost in half at one point. But it's because, to us, all of these things are really important. And so what we ended up kind of having to do was narrow the focus in to say, these are the things that would make a really big difference if you did them, when you do them. Power positive thinking.
And stop going backwards.
And and I think that's part of our responsibility as folks who are working in these industries too, in these disciplines, is to say, now we know there's a problem, what are we going to do next? And how do my decisions, my work, my research, how does it impact 1 billion people with disabilities, 800 million living in a developing country? How does it impact one? Maybe you happen to sit next to one person at USAID at a conference. You're like, hey, did you know that you spend 0.002% of your money on, and did you know there's 800 billion? And you can clearly tell I've done this a few times, sitting next to people like that. Like, oh, can I have your card? And your card. So that's when the report does come out and you get a chance to look at it. I hope that you'll also take it from a kind of a proactive approach. Say, got all this information, and I'm going to do something.
Well, actually, in connection to our larger research, Ashley's approved dissertation is on USAID. And she's incorporated systems concept and disability inclusive development to try and help them identify leverage points for intervention and inclusion disability. So one of the key findings is their outdated policy and how that can be a leverage point for inclusion. But I think this lays a really good groundwork in that relationship building. So the report may not be the most positive report in the end, but people are seeing its value and that it's a necessary action. And that, the relationships you build over there too, is they're like, okay, help us. What do? We don't even know what we're doing.
And at USAID, they've said, when I asked why they don't have a disability coordinator, it was kind of a broad answer of, previous attempts to fill the position under the previous administration were unsuccessful.
Mm-hmm.
And then I did a little digging, and I was like, you never posted a job, so that would be really hard to find someone.
Mm-hmm.
And then when I went to them with my dissertation idea, I said, so here's the thing, you have all these problems, and what I keep hearing is that you don't have the resources. But what if you did have the resource to have somebody kind of put a plan together for you? And I was honestly shocked that they said yes, just because getting some of the information had been so difficult. But my hope is that, fingers crossed, I haven't sent back everything yet. But it's this idea of saying, it's not that you don't have the resources, it's that your resources maybe aren't as effective as they could be currently. So how can we kind of look at some of that efficacy? So, yeah.
Yeah, and there are pockets of information out there, different disability toolkits out there by various organizations that have already jumped on the boat to kind of see how they can operationalize this on the ground. So, like she said, it's a challenge of, we want to do this, but how do we actually, get this information together, get it cohesive, and then see how we apply it to the field, and see hopefully the work out. I also comes to, the issue about adaptability, if they go, I was just thinking, if we have, is it possible to have a blueprint for disability inclusive development, and then that can be adaptable for various populations? I don't know if that might be something I think about
They
going
have, I
forward.
think, like you said, agencies have it. David's disability policy, for instance, really good. They overhauled their entire approach to disability inclusion just in the last couple of years, and now they're having a conference, and they have a team, not even one person, but multiple people. And I think again that comes back to this idea of valuing persons with disabilities for their potential contribution and recognizing that people with disabilities are people. And so if we're going to talk about doing things from a rights-based approach, or we're going to talk about doing things not leaving anyone behind, you have to include that group, or what you're saying no longer has weight, And so I think part of that is it's education. It's doing some of the work we've been doing to collect data, and then it's sharing it with people and saying, and what are you going to do next? And kind of following up that way. So maybe this will be a nice little toolkit for all those folks who are wondering how to do it.
One of the things that Valerie said before was that it's not a positive report. And that doesn't necessarily mean to imply in any ways that it won't have an impact. Positive and negative reports all in places. And it depends on how it gets translated and how it gets interpreted. And I think that one of the more brilliant sentences in the Americans with Disabilities Act was the disability is a part of the human experience. Just to just say it's a part of life in some ways. And so that's some of the challenges of beginning to get people to say is any agency, if you're running an agency at some point, you'll get into the business of the fourth person of the day who talks about their constituent group. And you say, well, how do I put it together? And I think you put it together around people. And Oxfam actually did a very interesting shuffle when they did it about 10 years ago. They decided that really the focus of their effort of systemic change would be through individuals, an individual's voice, and getting people to speak up for it. And I think that's true, but I'm not so sure that that's the only way. I think reports like this certainly go to that direction, beginning to make some changes. And the challenge you guys are going to have when you go out is around making those changes. The other thing I think a little bit about is that we're talking about areas of respecting people in general, having regard to folks, regardless of whether it's gender, race, whatever it is. That you don't have to be an expert on the disability to realize that many of the communities that we deal with are excluded for some never just reasons. But we're also talking about, to some extent, the people we encounter who are working in governments or public arenas or whatever it is that they're working in. They were trained very differently. They bring up their early childhood experiences. So I can tell you that many parents were told in this country when they had a child with a disability, don't expect anything, just care for this child and take care of them better than that a few times. We know that that's really the wrong messaging. So we're constantly sort of struggling with this issue of better thinking, better innovation in us. And then how do you get people to embrace that and to change that? You can take it by beating them off the head, which is a litigious way of doing it, or you can take it by really cooperating, getting engaged in some ways. So, you have to have a very good toolbox to make change. And part of it is a report like this that points out some issues of, I think actually comments about, what your percentage of investment is in the population. It's kind of one of those gotcha ones that you can always get. It's great in a cocktail conversation. Usually gets the person to drop their glass and they're totally embarrassed. But it's really that sort of messaging that goes back in the heart of it. It's really a lot around this issue of people in general, and then sort of recognizing that you started going. Really go with that. We have a long way to go. I mean, we're going to get there just by doing reports or just by doing initiatives right now. We'll get that by collectively making changes and invest and sort of make some impacts on the whole issue of service delivery system to say, yes, in fact, that everybody should be included. It's a great start. Doesn't always work, as we all know, but it really is a great start. So it was really a very interesting. I want to jump in, but I just got talking to Judy
Oh, that's so funny.
today.
I bet you follow her on Facebook, don't you? It's a good one.
But it's just there's so much that's going on. This is really a wonderful example of taking bits and pieces and slices of it and looking to come out back to the same issue. We get some flaws and we could really work on it, but we can work on it. There's some strategies. We've got some pretty specific steps that people can begin to look at, whether it's World Bank, whether it's the big characters in the world who can make a difference. I think they will start making a difference when we start pushing for it.
And I think we could have had a lot stronger recommendations on legal reforms and compliance if we had a different administration. I think the hardest part about this report is that the progress and promise, we would consider this a launch. Like, what is possible with next step, and seeing a backslide, it's been a bit more difficult to say, like, where can we go next, or what can be done next. So this is a very pragmatic and what's changed between
And that's who our intended audience was. So when we got looked at the grant for this, it was, this report is directed to the President of the United States and Congress. And so as we're
We
writing
have a very
this,
different president.
we were like, okay. And then we started this project in September. And then in January, or November into January, we realized like, oh, I guess we're going to maybe make some changes. And we had started some stuff where we were starting to have to screenshot whole website pages and things because one day the information would be there and the next day it wouldn't. And I think that's also some things that we have to think about too is, what can we do with what we have? Because unfortunately, we can't change certain things. But what can we do with it? And so that's kind of how we approach the report, I suppose. And that's why we focus very heavily on the different agencies with the hope that maybe we can make a little progress in each one, and that contributes to a better overall perspective of the situation.
So we're out of time for today's session. If you have other questions, you can email our wonderful presenters. So thank you so much, everybody, for your wonderful comments. And thank you, everybody, for joining us.
Thank you.
Thank you, guys. You're welcome.
Thanks.
Thank you.